March 2020 marked the beginning of COVID-19 and the beginning of a harsh new reality. As governments encouraged social distancing and quarantine, schools and workplaces began to shut down, thus creating the era of online learning and working. But as people quarantined, COVID-19 was not the only health concern. The well-being of children and adults was at risk as isolation and social distancing took a toll on the mental and physical health of adults and inadvertently risking the well-being of developing children. Children and adults were suddenly thrust into something they never experienced before, and technology became even more integrated in everyday life. According to the COVID-19 pandemic, technology used to support the well-being of children, behavioral health experts recommend building 5 dimensions of well-being in children: social, physical, emotional, intellectual, and spiritual, and technology became one of the biggest factors in trying to maintain and manage the well-being of children and adults as they navigated their new realities. The social well-being of children was affected greatly by the pandemic. Being stuck in isolation meant that it was difficult for children to continue playing with friends. Children who play outdoors experience better motor development, focus, lower obesity rates, reduced attention deficit hyperactivity disorder, less anger, aggression, stress, and depression. Thus, many households found themselves spending more time together, hiking, walking, and biking. Technology was also a big help in helping children socialize, as playing games, social media, watching movies, and listening to music allowed them to not only connect with others online, but connect with family as they shared interests. Children's physical well-being was also at risk. While children are not in the high-risk group of COVID-19 for severe illness or hospitalization, it was difficult for many to attend hospitals or clinics due to the fear of spreading COVID-19. It was especially difficult for many disabled and immunocompressed children. In order to overcome such difficulties, many facilities became reliant on online video calling platforms like telehealth to provide the services that could not be given in person due to the pandemic. As for spiritual well-being, many places of worship use video calling platforms to help their communities keep connected. Throughout the pandemic, caregivers were encouraged to reassure children that adults that they trust, such as doctors, nurses, police, or teachers, are doing everything that they can to keep them safe. This helped regulate their response to COVID-19 and keep their emotional well-being at balance. However, reducing children's exposure to COVID-19 in television and social media was difficult, as technology had become an integral part in connecting as isolation became more difficult. Many children found themselves relying on social media and online gaming to create emotional bonds and keep their mental health in check. This cut into their intellectual well-being as well, as school closing caused disruption in teacher and student networks, leading to poor performance. Schools, students, parents, and teachers were all at a disadvantage, as the traditional classroom was not prepared for the sudden change. Schools and teachers had to adjust to new circumstances quickly. They were required to redesign their coursework from school-based structures to home-based, technology-enabled, distant learning facilities, thus creating a platform for e-learning. E-learning is defined as a new model of online learning based on information technology. Traditional learning methods were pushed aside as e-learning became the new reality. Studies show that the students' performance was much better in online learning than in traditional learning. Researchers proposed that course design, quality of the instructor, prompt feedback, and student expectations are the 4 prominent determinants of learning outcome and satisfaction of the students during online classes. Course design refers to curriculum knowledge, program organization, instructional goals, and course structure, while quality refers to a professional who understands the student's educational needs and is able to use their experience, skills, and tools to meet the student's learning needs. Prompt feedback is defined as information given by teachers about the performance of students. It's the consequence of performance. Lastly, student expectations is measured by the impact of student expectations on their own performance. As students' expectations are achieved, then so are higher satisfaction levels. The graph shows the connection between these 4 essentials as they relate to student satisfaction and student performance. The more these determinants are properly met, the better satisfaction and performance. However, there are factors that cannot be ignored when it comes to e-learning. While many hope that the future of education can evolve as technology advances and classroom change, there are still many social and economic issues when it comes to technology. The pandemic has greatly impacted Black, Hispanic, and Indigenous communities. Quarantine has denied many students from these communities the opportunity to get the education they need. There's a significant amount of data that shows the disparities in these communities. Data from Curriculum Associates' iReady platform found that students in their sample example, only learned 67% of the math and 87% of the reading that grade-level peers would typically have learned in the fall. This means that students lost about 3 months of learning in mathematics and 1.5 months of learning in reading. The learning loss was especially acute in schools that predominantly serve students of color, where scores are 59% of the historical average in math and 77% in reading. For those children who remain in the K-12 school system, the challenge is having the tools and resources to connect and learn in remote environments. Many schools have tried to distribute devices, connect students to the internet, reconnect with homeless students who had fallen off the radar, and put in place new regulations and benchmarks on remote instruction. But of course, there are still issues regarding technology access. The October U.S. Census Bureau Household Pulse Survey shows that 91% of households with K-12 students always or usually have access to a device for learning and internet access. Although there has been a change since the spring, Black and Hispanic households are still 3 to 4% points less likely than white households to have reliable access to devices, and 3 to 6% points less likely to have reliable access to the internet. Many Black and Hispanic students are also twice as likely as white students to have received no live contact with teachers over the previous week, and are 3 to 6% points less likely to be receiving consistent live instruction. And although many students are not going back to live instruction, students in urban areas and large school districts are most likely to be still learning remotely. If these issues are not addressed, many students of color will have a hard time developing intellectually than their white peers. It was predicted that students on average would lose 5 to 9 months of learning by the end of June 2021. Students of color would be 6 to 12 months behind compared with 4 to 8 months for white students. Many schools, teachers, and communities have tried to gather information and resources by using online networks and social media. Research has shown that online activities such as participating in personal and/or personal networks, reading blogs, tweets, and accessing other online resources can significantly contribute to school leaders' abilities to adapt to new circumstances. Thus, social listening is necessary, as technology has created platforms for students, teachers, and parents to share their worries. Social listening is an innovative and relatively new research method for gathering and making sense of large amounts of data. The word clouds shown are visual data collected by TalkWalker, a social media analytics platform that allows us to see what people were most concerned about during the quarantine. Research found that students, teachers, and parents all had different concerns during the pandemic, but they shared concerns such as mental health, school operations, and education. These online conversations are important to observe as school districts and leaders come to understand the needs of their students and faculty as they try to cope with new learning environments and the rise of e-learning in the digital classroom. School is an integral part of a child's development, so it is important for schools to take bigger steps in adjusting their curriculum, teaching, technology, and supporting infrastructure in ways that go beyond the current traditional classroom. They could start with a focus on addressing the socioeconomic difficulties that students face as e-learning is implemented in returning classrooms and providing teachers with necessary tools, experience, and compensation for their effort in integrating technology into their classrooms. Technology is now a big part of education, and it will take a while to adjust. But as children develop in these new environments, it's always important to help them maintain their social, physical, emotional, intellectual, and spiritual well-being through this new digital era, especially now that COVID has pushed traditional classrooms into new technology-based classrooms.